you for taking the time to come to this meeting. It's gonna be really quick. It's not gonna be long, but we've been brainstorming. Should we do introductions?
Yeah.
Okay. Go ahead.
Hi, my name is Amanda Perez, member of Community Board 1 and director of the Bronx Heights Family Enrichment Center.
Welcome.
Good evening. Jose Quintana, New York City Department of Health and Mental Hygiene.
Stephen Palmer's Community Coordinator, Bronx CB1.
All right. So we are still talking on old businesses. We're gonna put a hold on the health symposium because I know we have to brainstorm other ideas for that. So we'll definitely bring that forward for the next meeting. But we do want to tap into the health fair. That is the check-in that we want to discuss. Our set date is August 1st. We're still working on it. It's on a Saturday. And correct me if I'm wrong, Stephen, we said that it was going to be like 9 to 5, but we're going to set up from 9 to 10 or 9 to 10:30?
9 to 10 and then break down 4 to 5.
4 to 5, right. So that's going to be that time. And as we go along, I am going to have I do have a drive where I am writing down the overview on what's the purpose of the health fair. As of last month, we want to cater to that specific community in that area because we want to ensure that everybody is receiving the proper resources. There are a lot of stuff that's happening right now with health disparities in terms of health insurance and just the lack of. And so we want to be able to bring the community to a full awareness of everything. But from speaking previously, we've realized that it would be a beautiful event to collaborate with other committees as well, so that everyone has, they can have a say and also the effort to participate on the fair. So if you guys have any, comments or any ideas, please let me know. Yeah, go ahead. You want to zoom in?
I'm going to hold back on ideas and just share comments. I think that this is a great idea, especially in this part of the Bruckner. I could be a little biased. I only share that because the Bronx Heights is right across the street. But we have we've used this park for the last 3 years, and it's been so good. And I will share the difference between Pulaski Park and St. Mary's Park is that the community members who use the park every night clean the park.
Oh, I love that.
And so they do big parties, especially in the summertime. And if you go the next day, there's a big chance that it's already going to be clean.
Yes.
Because they clean up after themselves. So they definitely take ownership of this park. We've had a great time. We've used every single part of the park before. It's super safe. And it's been great.
I love it. Thank you for that. So, what we see right now is the Google map, and the park it's so big. It's straight. So it's like there's no like hills or anything that you have to get to another court. There's a soccer field. There's 2 basketball courts. There's a big playground. There's swings, and then there's a workout park. And so I want to be able to utilize that whole entire park of different zones. So what I was brainstorming was the zones that I think would be suitable. So like it would be obviously zone A will be the registration and welcome. We'll have event schedules, raffle sign-ins, and things of that nature. We'll have the clinical screenings. So what we discussed last month will be the mobile screening, screenings for blood pressure, diabetes, dental vision, STDs, HIV, mammogram, colon, all that stuff. So we want this health fair to be big, but not just a health fair that is just for resources. We want to be able to have activities, jump rope. We want to have like a session for nutrition to educate the community how to eat better and know what type of produce to select. And a lot of other stuff, a fitness check-in. So we're brainstorming this, and we want to be able to gather everyone's committee to take a part of what else we can be able to utilize that big space. Stephen, anything?
I mean, so when we had the original discussions, right, we were talking about utilizing that half of the park, so where the athletic field and then the first basketball court are, and then I'm guessing not use the other side because obviously people might want to use the park still.
Yeah.
We don't want to take the park away from anyone using the park, so we would still let the general public obviously use the mini playground and then one of the basketball courts. That way, there's not a mob after saying like, hey, you guys are using the whole entire space and we want to play ball,
Yeah.
Because again, the park is big enough to support, a community event while still having the other side of the park open to the general public. Ms. Perez, I had a quick question since you're familiar with this park. When doing the events that you've done before, when it comes to like potentially food vendors, have you had them alongside the Bruckner, like on that sidewalk there, or have you had them inside the park?
Inside the park, but I applied for the food fair license, which was good for a whole year.
Okay.
And so we would bring the food inside.
That's good.
Because now I'm thinking also because I don't know how this depended on how many mobile vans we have for all these health services, right? Do we have enough ample space to also provide food food trucks inside the park, or they have to be outside, right?
Yeah, because I don't recall a way to get inside.
Right.
You can't drive in.
No, obviously. Okay.
Yeah, so you can't drive in. What we did so 2 years ago, we had a huge grill, and we were doing burgers and hot dogs, but we needed parking spaces. So I had people come in at like 6:00 in the morning to try to see if we can get some parking spaces. And so we were able to do that. And then this year, I want to say Metro PCS came and they had like a really cool van. And same thing, we had people come and try to get these parking spots early.
Are we gonna need NYPD to help us with that?
Yeah.
Because the thing is, when they redid that block again too, so they added the bike lane and they added.
Oh my God!
I forgot about that because I wasn't there last year. So they redid that whole.
So it's not direct. There's not direct access to the sidewalk now because it's a bike lane now.
Exactly, and now they park where the bike lane is at. There's cars parked.
Is there a bike lane on the other side of Bruckner too?
Not across the street.
No.
Because I might have to look at alternatives in terms of. Because if we want to have mobile vans, then we have to find a place.
But is there a way where we can get what I'm trying to ask is do we get an excuse if we complete something or negotiate something with NYPD or something like that?
Yeah, I mean you can obviously we could reach out to the 40th precinct.
They just added that too this year.
And then maybe getting some additional support from the Borough President's Office with their
for the bike lanes.
Yeah, with help securing NYPD support with that. I think as long as NYPD gets a proper breakdown and layout of what the ask is, and if they obviously can accommodate with ample time, they'll able to support, in my opinion. So.
Okay. I did speak to some of the people for some dog events that they have that they host in the area, and I wanted to just also include them as well. So it's not just a senior, toddler, it's for everyone. There's a lot of stuff that's happening, not just amongst humans, but everyone is faced with health disparities. So where I had envisioned, that's what I wanted to also add, is that the tabling, and let me know, because the tabling mindset would be in the soccer field. Do we have any other option where we can add the tables, or no? It would just specifically be on the soccer field.
I mean, the soccer field is the most level, and it's the most out of that little. If you cut up the park, right, that's a biome in itself that you can have a complete layout of tables of people just walking through, and then kind of that seems like the biggest opportunity, and a lot of who we partner with, a lot of health insurances have their own tents and tables. So I don't thinking further, because the soccer field, obviously there's no trees, so you're out in the sun exposed, but I'm pretty sure they can anticipate that by bringing their own tent and stuff like that. So.
Yeah, that sounds good. Yeah, you can.
We held an annual fall festival, and we often have it sponsored by insurance companies, and they provided At one point, they provided, there was one insurance company that provided all the tents.
Wow,
and
that's
tables.
amazing.
That's
That's
And
something that's
then
needed.
then there were other events where they were only providing maybe 20 or, we had 40, 50 vendors come to our event a couple of years ago. And we had one insurance company, I'm not sure if it was Emblem Health or which one it was, that covered, they provided all the tents and all the tables for all the vendors.
That's
Oh,
amazing.
And,
yeah.
I need that.
they may, well, no, our action center director, her name is Kim Freeman, the person who used to organize it, he retired last year, but this year we did it again, and we did have an insurance company sponsor some of the tables and tents, and then some of the partners, some of the vendors themselves, they brought tables and tents, but that's something that you may want to, look into and see if there are any insurance companies that may be able to provide that. The caveat is that they sometimes want to be the only insurance company at the event.
Mm.
And that's not always,
Mm-hmm.
fair, but sometimes, it works out.
It works out.
Yeah, and, it'll have all their branding and all that stuff on it. So they do get a lot of, promotion from those events.
Thank you. So, I also wanted to add that the permit request has been submitted, so we're pending for that park. So I guess
Do you know what part of the park is the permit for?
I'm not entirely sure, but I think it was submitted with the ask of that so the athletic field and one of the basketball courts, like up until that space. So we see here,
Yeah, those two parks.
the vision,
yeah.
the vision was this, because again, we had a discussion
Mhm.
thoroughly, we're just like, we kind of don't wanna anything everybody.
No, I agree.
So we were just like, if we split it right here, then it gives the general public access to one basketball court and then the playground, obviously, so the kids can play. And this would be the community board fair space.
Mhm.
That obviously people can, general public can also
Right.
go in and kind of fluid kind of sort of way, so that.
And we need sponsors.
Yeah, so I believe the interns have been working on a database to get a cohesive list of sponsors. That way, I don't know about the next steps.
It's okay. So I do have a DJ in mind, but I just want to make sure that we're all on the same page to how we can be able to help, because we want people to get paid. And then for what Christine had mentioned last month was getting an artist, like a makeup artist or like a face mask painter for the kids.
We had all of that.
Yeah.
We have connections with all of that at our office because we always have a face painter. We would coordinate with the NYPD to put up the signs that there's no parking on this certain day. We've had you said you got a DJ, but we had a connection with DJ. It could be the same
Yeah,
DJ.
no, yeah, for
I
sure.
have a couple vendors in mind that I can procure.
If there's anything-
Take a decision made.
If there's anything you feel that you need any input on and stuff like that, please reach out to us, because I'm sure our team would be glad to provide input into.
Jose has been a great friend to the Health and Human Services. Health, Human, and LGBTQIA.
I'm all for that. Do you guys have any other questions or anything?
Another question. I'll share that when we do our events, we incentivize committee members to do certain things. So like my face artist is somebody from Pulaski Park, and we give them like a $50 gift card. Same thing with DJs. Actually, you can't see it now, but in the I'll show you exactly where it's at, because this is where you can put the DJ. There is
Not good.
not blue though. There is a pole here, and they created, like the community members created like a makeshift electric outlet.
Okay.
And then you can put a generator in there, you can put your DJ
wow.
in there. Yeah, they're very resourceful. Very resourceful. But whether it's helping for cleanup, we can get some community members, give them $25 gift cards, and they'll be open to helping as well.
Yeah, I'm like trying to see if we can include it, because we're gonna discuss this on the executive meeting, obviously. So we want to be able to present that to everyone else at the board, because eventually each committee is gonna want to partake. They're gonna want to do something. But for environmental committee, what's the merge committee of that. That's the
Municipal services and
Yeah.
environmental justice.
yeah. So I think they will, they know people for what was
I mean,
it?
yeah, I think
Earth Day. They had a
uh,
bunch of people collect.
Nos Quedamos. So Nos
Nos
Quedamos is the
Quedamos.
main CBO that partnered with the committee at that time for so I think they're interested in
All right, well, I'm excited. I know. It was just like pretty much an update on where we at, but that's pretty bad. I don't want to change the date. I don't want to change the location.
I think once this is spoken on at the executive committee, then I think my suggestion is to create just a email chain with all the committee members, so that way everybody's in the loop of where the status is at and just frequently updating.
Yeah. I'm down for that. All right, well, pretty much we have new business. What's the new business about?
This is Samaritan Daytop Village's park.
For March?
Yeah, so they will be, they've committed to coming to next month's meeting.
And they want to present?
Yes.
Or?
I'm not sure the details, I just know they sent a request and we sent them a committee presentation form and they filled it out.
All right. The flyer, I'm gonna send you the flyers of because I already have templates. So for the flyer for the health fair, but also flyers for the committees, and I guess flyers for. I believe we're still working on the survey piece, but the survey piece is something completely different that is attached to the health symposium. So I guess I'll give you guys feedback on that or update on what's going on. But do you have anything else?
I mean, speaking about the survey, we could retrofit it to just be part of the health fair. That way we do get input from it's a good opportunity. We're gonna have a lot of foot traffic. We get input from the community directly. What do they feel are the health disparities?
Yeah, we're still gonna need a survey regardless.
Right.
Yeah, for health. Yeah.
We do that too.
I know.
We just had a meeting of that recently that the community responded. We had it was a low response, but still it was valid, and we feel it was valid enough to get enough feedback as to what they would like us to address in the community. So surveys and those types of things are definitely helpful. There was a system that was put in place for us. We had what was called, we call it a passport. And basically what it is a card with little boxes on it, and we give each vendor a thing of stickers so that as the community residents come through, they can get their sticker, and there may be prizes or giveaways and certain things like that. And it can also ensure that folks are visiting a lot of the tables.
Mm-hmm. That's one of the best ways to do these kind of events because people will skip over the tables and go to other things. So I love that idea. I was gonna ask about the survey. Is it a particular survey that community board wants to kind of put together? Or is there a world where we can reach out to organizations who are already doing this work, like South Bronx Unite, who may have multiple surveys?
I think we mentioned that last month about South Bronx. I was like, I'm open to that. I'm open to anything and everything because at the end of the day, we're here to try to figure out what's the main focus, what people are, concerned about. I'm open to that idea, and even to collaborate, whatever it is, I think that's important. If somebody already has a template already set,
100%.
you know what I mean? Like that would be easy for us. We're not taking away from that, but it's just to relay the message to the community about what's going on, what's happening. I'm open to that. 1,000%.
What our fearless chairperson Martinez likes to say: "There's no need to reinvent the wheel."
Yeah, no. If someone else is doing it, just pass forward.
Yeah. And South Bronx Unite does a lot of research on this kind of work, so they may already have something that they've been working on that the community board can support. Send it out,
I'm down for that, to be honest.
If you want to make it as an action item for the executive committee, I can afterwards reach out to Devin Conchon, who comes here often from South Bronx United, or also Matthew Shores.
But also to have a meeting with them too, because what I'm saying, it is right. Like they're researchers. They get to know and understand the disparity of the Bronx, of what we're dealing with when it comes to asthma and things of that nature. I think that's so important. It's still health. It's still health and human.
We can open that dialogue.
Yeah.
Is there anybody from South Bronx Unite that is a part of the community board?
Matthew.
So I think Matthew should actually be assigned to this committee.
He's part of municipal and environmental justice.
Oh, yeah, that's
environmental
true.
justice part, but he does check in on other committees. Like he's very active in economic development as well. He likes to chime in as well. He was here last month's meeting. So again, I think Matthew can be a point person or someone that works with Matthew as well.
No, listen. If anything, let's set something up so that we can all chime in and figure out, because I want this event to be successful. I don't want it, and I want everybody to feel like, this is something that they can all be able to participate.
I mean, the important part is the permit applications in, because
you made me
happy.
That step. I know.
People forget that step. It's like the event is 2 months away. You have to put in a permit. No.
So the permit was last month. That was a discussion. So they got that out the way. So now we're pending for it. So hopefully we can be able to get the yes, and then we can also have collabs. Like maybe somebody else would want to, get a permit for the other side of the park and do something else. We can, open that as well. But yeah, I'm good. You guys have any other?
I think Mr. Quintana had something to.
Yes.
Yes. I would like to share some information regarding some services that are available at our office. Our office is located at 1826 Arthur Avenue, and I'm just going to go through these pretty quickly. One, I just want to share our quarterly calendar it's chock full of resources and information about our action center. So I'll just leave that here. Another one, this is integrated pest management program, is for families that have children under the age of 17 years old in the household, and they have in the home is showing signs of pests such as cockroaches and mice. And this is because we are the City Department of Health. These are free of charge. They're available to folks, anywhere in the Bronx. And we have a number and an email available here for anyone who's interested in the services. Again, they are free of charge. I also want to share information regarding our nicotine replacement therapy program. We have the nicotine replacement therapy for anyone over the age of 18 who is interested in quitting or cutting back on their tobacco or vaping use. I'm one of the counselors, so I can, they can link up with us, or we can come out to different events. Whenever I go to health fairs now, that's one of the things that I do, is I ensure that I take out some of the nicotine replacement therapy medication in case I'm able to, in case there's someone right then and there who wants to, start addressing their smoking, and we're able to provide them with the medication right then and there. They walk away with it. So that's the nicotine replacement therapy, and we have a new. Yeah, no, all of these are staying here with you. I don't want to take a cut, but we have a new list of services. It's out of our navigation hub, and we are partnered with other divisions within our agency to help provide things that folks in the Bronx need here in the Bronx, as opposed to traveling downtown or to Queens and things like that. So I want to, I'll share these with you, and then we can, I'll just quickly just read off some of the things here. If folks who are interested in getting birth certificates, death certificates, and things of that nature can come and work with us, and we can start getting them set up so that those, so they may not have to, run all the way downtown to do that. For folks who are needing immunization records and scheduling vaccine appointments, we realized that after the clinic was moved from out of our office, we were still getting a lot of parents and folks coming in. So we are providing that information, helping folks complete requests for immunization records and schedule vaccine appointments.
Amazing.
A couple of times a month, and some of our events that we've had, particularly we had one last week. We had a produce giveaway, and we had the dog licensing unit come out to our office, and they were providing folks with licenses for their dogs right on the spot. We have a health insurance enroller who comes into our office twice a week, and she does the health insurance enrollment as well as SNAP EBT enrollment.
Nice.
And we are also offering for folks who are interested in starting a small business and applying for the Minority and Women's Business Entrepreneur. I'm sorry, I forget what the MWBE all stands for. But if they want to apply for the certificate, that will allow them to do business with the city we are working with them to do that. We're also helping folks repair credit, starting, financing, operating, and launching a small business. And then, so those are some of the services that are currently available out of our office. And all the numbers and emails are there listed on the flyers for anyone who's interested in, getting any of these services.
Thank
Okay,
you so much.
and last week,
I have some questions regarding this.
Yeah.
Um,
If I can answer it,
yeah. So one, I love this. I feel like there's been some funding around these navigation services, and they're expanding, which is amazing. My questions are there criteria? Like, do you have to be within a certain threshold to be able to qualify to get the support here?
No, we've never discussed that. I don't think there are any income thresholds. There may be like age in terms of, and that'll probably be 18 and over, because we know a lot of young people are starting, their businesses, whether online or brick and mortar or what have you. And so those, I do not know of any restrictions. We have not been told of any. The only restriction will come when it comes to the IPM, the integrated pest management. You need to have a 17-year-old living or someone under the age of 18 living in the household with asthma.
Okay.
But otherwise, there are no other limitations.
And then for the birth certificate, is the Action Center paying for the birth certificate or the death certificate?
No, we are now. That is still going to be up to the constituent to pay for that.
Okay.
So it's more mainly connecting to
It's connecting to
It's
them,
a navigation,
so like that they don't have to run all the way downtown all the time and make multiple trips.
It's like a satellite.
Yeah, so we're navigating them and helping them, providing information and resources and things like that, so that when they do go to pick, to get these things, they're already fully prepared with it, whether it's with the things that they need to have in hand, or their application may already be in, or the request for like these birth certificates and death certificates.
Anyone can go over there. It's not,
it's not limited to
to
a district or community board.
Perfect.
We are the Bronx.
Okay, perfect, beautiful. Thank you so much.
You're very welcome. And just one more thing. I know you and I had spoken about it, or at the end of last year, the possibility of a Narcan training to the opioid overdose prevention program. And last week I was able to speak with Mr. Jordan, and we'll all be in discussions moving forward. He said sometime possibly in May, when people are going back out into the street and those types of things are occurring more often in the street. And we'll definitely, and I'm one of the, I'm one of the counselors for nicotine replacement. I'm also one of the distributors of the Narcan, so I can come in if you guys want us to do something, here in the office. We can set up a time and day and stuff like that I can be here for a few hours. And
I want to do one for the office, and also I want to do something for the media. So we can just tape it and then also educate people. This is not just like a stigma. You have to know how to use this, because it can help save a family member or someone's life.
Well, in regard to media, you know how the city is.
I know.
I'm not sure if that would be involving our press person or our assistant commissioner, Anita Reyes.
I got you.
But,
I think what I'm trying to say is, like, if there's already a video on YouTube that doesn't have, like, it's like the how-to, you know what I mean?
Yeah.
I think that would be much more fun, because I get you.
And as for me, I'll be honest, I would not have been able to do Narcan about 4 years ago or so, because it's impacted my life. Opioids and substance abuse has impacted my family and my life. So I didn't want to have anything to do with that. But, over the years and learning more and hearing people's testimonials, these are family members. They are brothers, sisters, husbands, wives, moms, sons and daughters. And, we're giving them a second chance to make a better decision, or we're giving them another chance. Sometimes it's not the second, but we're giving them another chance to make a better decision about their lives and the things that they're doing. So,
I agree. Thank you so much. I appreciate you guys for coming and just, sitting in and figuring out what we're going to do.
We got to work together.
I know, right?
We got to work together.
And also, in regards to the Narcan, I saw something like that for the Epi. They enhanced remember, like the EpiPen?
Mm-hmm.
They have one that's like that you inhale.
So what we offer is there are two forms. There's an injectable and there's the intranasal, and what we offer is the intranasal, which is just the nasal spray. The nasal spray, yeah. like the nasal spray.
Oh. I'm like, I want to know more because there's a lot of people that I know that are allergic. I'm allergic to pineapple, like the worst fruit everyone loves. And it's like, it's good to have that just in case.
Oh,
yeah.
Like EpiPen. Oh, yeah. So the
Yeah,
and
no,
then
EpiPen,
there's
I
something
carry
new.
one.
Yeah, I heard something about that recently. There's something new happening with the EpiPens. I'm not sure if it was the legislation to reduce the cost of them, or if there's
It's
another.
too expensive.
I'm sorry.
It's too expensive.
Very expensive.
Yeah.
One pen. The last price I heard for one pen was like about $80 or $90, and that might have gone up.
It went up. I think last I heard was roughly almost $2.
Almost 200.
Yeah, almost 200.
Oh, my
It
Lord.
was like 180 around there.
Because
Yeah.
80 was the pre-pandemic price.
And I had to get some for my kid because as they get older, all of a sudden they're allergic to peanuts. Like, how you was eating PB&J when you was like 4, now you're allergic to peanuts. It's crazy. Yeah, but thank you so much. I'm gonna adjourn the meeting. This meeting is adjourned. There you go. I'm in